Welcome, everyone. We are so glad that you joined us for the College of Management and Human Potential Virtual Symposium.
Hi, everybody. Welcome. I'm Karlyn Barilovits. I'm the Dean for the College of Management and Human Potential. Thank you for joining us for our research symposium. Today, we have Will Schulz with us to discuss how our college programs can align to the social determinants of health. Will is the Associate Dean for Academic Research, Progress, and Completion. Will is also a former Associate Dean for our college and a contributing faculty member in the PhD management program. Welcome, Will.
Thanks so much, Karlyn. It's good to be back home.
You always have a home with us, even though you keep going all kinds of other places. So we have been talking about social determinants of health. That's really been a big topic since we joined Adtalem. And so we really wanted Will to come in and talk to us more about a chapter that he did and also some of the work that he's doing. So first of all, Will, please give us an overview of how the social determinants of health framework aligns to Walden's mission.
Sure, thanks. So I think it's important to know that Adtalem is they describe themselves as a center of gravity of what they do in their portfolio is health related, right, and healthcare related. Until they acquired Walden, that was almost predominantly healthcare delivery related. So nursing, medical schools, vet school, and the like. And of course, Walden has a tremendously strong nursing program and direct health stuff. But we also have a school of education and a college of education, a college of management and human potential, as well as a college in the social sciences more broadly. So there's been a challenge to tell the story about how these other colleges and schools really fit the Adtalem mission. And the social determinants of health framework is really the way to do that. So I'm going to share a couple of slides as we go, just to give people some visuals here. We'll go from there.
Sounds great.
So the social determinants health framework, which was really developed many years ago, is presented by the Department of Health and Human Services this way: these sort of 5 sectors. And I've changed it a little bit so it aligns with the College of Management and Human Potential here, because we're really talking about the social determinants of human health. And that's at the individual level in the center, and then at the family level, the community level, the neighborhood level, the societal level as well, right? So it's a broad systems thinking way to look at the way what we do, both individually and together, affects our health, the health of ourselves and our community. And it's broken up into these kind of buckets, and the argument goes and the data shows that one's individual health and the health of those around us is deeply affected by these major elements: by access to education and the quality of education, access to a good job and income and having economic stability, having an effective and safe neighborhood and built environment, having a strong community and social and community context and networks. And then, of course, the one that we almost always think about when we think about health immediately is access to healthcare and access to quality healthcare. Of course, that's an outcome, right? We go to the healthcare system when we need to typically respond to something that hasn't gone well with our health, right? All the other elements are really preventative and are really important elements of health, but they're not usually thought of in a health setting. So this is what the social determinants of health helps us do. And interestingly enough, when we look at the data, about 80% of what impacts a person's health long-term are not clinical. They're not, bound within our bodies, as it were. They are factors that go to social and economic factors, behaviors that are individual, and then the environment more broadly. You can see I've kind of outlined in green here these social and economic factors that the College of Management and Human Potential really can help start to address: employment, income, and the like. So I want to share another screen here This is the same framework, but now we're talking about Walden and how Walden has structured itself. I'm gonna, if I can, I'm gonna try to zoom in here a little bit as we go. So College of Nursing up here at the top, College of Social Behavioral Health, College of Allied Health, they're really looking at healthcare access, right? And providing healthcare and healthcare quality. Interestingly enough, the College of Management and Human Potential, we have healthcare administration, health leadership programs that are part of our college. They're really dealing here with how we can improve quality. Now, more broadly speaking, anybody in the DBA program or the PhD program or really any other program, but particularly at the doctoral level, you have opportunities to do research using the theories of management and leadership. And you can do that within a healthcare setting within organizations that either provide to healthcare or to hospitals, and you're still doing management work, right? So you can, one way you can think about connecting to this is to spend time looking at opportunities perhaps to consult or work within the healthcare quality field itself. Sarah Pavelka is a director of one of the couple of the programs in our college, and will argue, and we've talked about it before, there's tons of opportunity for total quality management and other approaches to improving quality of healthcare delivery. That's not a medical situation, that's a management and leadership situation. How do we help people prevent making mistakes, for example? That's systems thinking. So there's really good opportunities there. Then, of course, the main connection with the College of Management and Human Potential, with its MBA program, as specialty master's programs in HR and others, it's really helping address and understand economic stability. How do we build robust, long-lived, humane organizations that help foster people's connection to the world, not only just to make a living, but to make a life with it as well, to really bring meaning there. So I think this framework is really interesting because it's got the College of Education, College of Psychology, and the College of Management really, and Human Potential really can play in a lot of these different areas. So I'd like to kind of leave you with that as an overview, then we can get back to some other things.
Okay, thanks so much, Will. We know that you, along with several of your Walden colleagues, recently published a book featuring a chapter on social determinants of change makers. Tell us a little bit more about that project.
Yeah, thanks. So there are a number of initiatives out that are trying to, again, use systems thinking to understand the impact on individuals to achieve things. So here's the social determinants of health. Another one that our colleagues at Chamberlain University have developed is called the social determinants of learning. And this is trying to understand the way other various elements that are related to this one is, in fact, help either prevent or encourage people as individuals to learn, right? So having access to food, for example, we think, oh, that's a basic one. But there are a lot of students in the world, both undergraduate and graduate, who have food insecurities, right? So that affects their ability to learn. So there's the social determinants of health, the social determinants of learning. Nina McCune and I, Nina was the editor of our book, which is over my shoulder here. Nina edited this book. There are about 20 different authors from around Walden helped contribute. Julie Canepa, who helped organize this conference, was a co-author of one of the chapters with me. I was participating in 4 chapters, and one of the chapters that Nina and I wrote, which is the culmination of the book, looks at the social determinants of change makers, because we really wanted to show how Walden and how higher education in general, within an inclusive and teaching learning context, can build change makers, because that's Walden's mission. Our mission is to help each of our students, each of our mentees, really learn knowledge, disposition, skills, and commitments to taking that into the world and making the world better, right? Given their own unique issues and being leaders of change. So how do we talk about that within the university? Well, at the core of this model of social determinants of change maker is the heart of the person. The person is really dedicated to social change, and it's one of the reasons they're here at Walden. Then we have the social determinants of learning and health that surround us. So we keep looking at that. Here again, College of Management, the economic stability issues, sociocultural issues really can affect what's happening. And then we bring in our approach to inclusive teaching and learning, in which we as a community of learners and teachers together are seeking to recognize the humanity, the dignity, and the inherent worth of every single individual. That's something we think is critical at Walden, and we want to bring that to how we engage with our learners. Then we have essentially moving further out in this wheel, we want to do this within the context on the left of a community of care. So we recognize that everybody is working under tremendous stress and strain in the world in general, but clearly after COVID, that has ramped itself up multiple fold. So how do we think about policies and the way we do things in ways that allow us to show caring so that people can balance what they have to balance in their life? How can we both recognize and celebrate people's lived experience as we build curriculum and as we engage in thinking about what kind of doctoral studies somebody wants to do, is really tapping into, our working, adult lived experiences to help shape that, so that what they do is important to them and is important so that they can go out and lead. And then lastly, all of this kind of leads into becoming a scholar practitioner who could then gain social mobility and can help others achieve social mobility. So this is the kind of wheel of change making that we put together, which takes the social determinants of health and learning, social change mission at the center, and a inclusive teaching and learning environment to wrap it around. And we really hope to use this model to inform all of our curriculum, all of our teaching and engagements, and to really celebrate things like what's happening the next 2 days with the symposium, in which our students and mentees and now newly emerging doctoral scholars are sharing their work on how they are going to change the world around them. So it's really exciting.
It is exciting. Well, we have a question. Where can we get the book?
So the book is, I don't have a link, but I'll provide a link that we can put in. It's published through IGI Global. It's not inexpensive, but I do think you can get access to it through the Walden Library if you're a student. So you can get a virtual and download chapters as part of what's in the library.
Okay, great. Thank you. So we know that this whole symposium is about highlighting our students and our faculty's research. How can our students and also our alumni, because there are some alumni presenting, how can they make meaningful contributions through research to social determinants of health, even though it's not directly related to patient care?
Yeah, and I think that's a really important point is to first just have the mindset that when we talk and think about health, that we're not just thinking about care, providing direct care. That's really important. But ideally, the goal is to provide less care by not needing it, right? By preventing it. And of course, that goes to this is another way to look at the social determinants of health. Our psychologists and others, try to understand the way we as individuals can change our behaviors so that we don't smoke or we don't do other things that science shows are really damaging to our bodies. That's one way to prevent it. The other is the things we've talked about, to make sure that there aren't institutional inequities, that people have access to good work, and that work is fulfilling, and that it can lead to a living or better, a thriving sort of income. So how do we build businesses? How do we be entrepreneurial? How do we build capacity in communities? Yeah, so community building. How can we engage civically? So for me, I would say real big opportunities in our college, because we are talking about human potential, and humans ultimately in any capacity are working together within a leadership context. So for me, focusing on leadership, focusing on system thinking and how you connect things together for human flourishing is the avenue to do some of this work. Give you some examples. One of the committees, Ina Williams just completed her PhD. She looked at the barriers that kept very talented minority candidates from achieving executive leadership in nursing, and how do you overcome those barriers? And of course, the PhD was in management. It brought in management theory, it brought in capabilities theory, and just happened to, because she's a chief nursing officer herself, she wanted to study and talk to people that were in the nursing field. So it's not a nursing doctorate per se. It's not even about healthcare per se. It's about how do we break barriers so talented people can rise in their field. And in this case, we know there is evidence that if you're treated by doctors and nurses and others that understand your background and your ethnicity and your minority or marginalized status, because they are themselves, that your health outcomes improve, right? Another student, a mentee of mine, is looking at faith leaders in rural areas. So how faith leaders can engage with others in rural environments to help reduce the disparities in health outcomes. Again, a management function, a leadership function, but looking at it within a health context. So that's really a direct way to do it. Other ways to do it, really look at, like we said earlier, looking at quality management and how we can apply, really good quality management ideas to healthcare. I know at least one of your presentations the next 2 days is looking at Deming and quality healthcare. I mean, looking at Deming, I don't think it was in the healthcare setting, but nonetheless, Deming is still relevant. He's one of the founders of the field of quality management. Unfortunately, there's a lot of room for improvement in the way we provide healthcare. So bringing those quality approaches, I think, could be really important, as well as looking at ways in which we can, again, through the lenses of management and leadership, look at ways in which we integrate. So how you look at corporate social responsibility issues and others, how can private businesses integrate into society and community and support society and community? That's a really interesting one. Engagement with communities to support and build systems beyond just the narrow business. So benefit corporation, there's lots of research that could be done looking at benefit corporations and what the benefit corporation organizational structure could look like in different fields. So I think there's a wealth of opportunity. The key insight is the key takeaway I'd like people to walk away from is that when we talk about health outcomes, we're not talking about just what you see when you have to go see the doctor, or I shouldn't drink alcohol or smoke cigarettes. Is how can I, as a leader, a social change leader at Walden, as a scholar, how can I study things and just pitch them so people can see that the research you're doing does in fact touch these things? And if the world could, if the organization you're consulting with can be more effective, that will increase people's well-being overall. I mean, that's the way we fit into this picture.
Okay, thank you so much, Will, for that insightful information. I think we'll open it up for questions now. We've got about 5 minutes before we want to let you go to your other sessions, but we wanted to open it up for questions or discussion. What questions do you have? I see we've shared the links to the book. Any questions for Will from anyone? I know everyone's frantically going to those links to look at that book, and then they'll have lots of questions.
Yeah, and I think too, if there's no questions, I think another important takeaway is, particularly for those doctoral folks that are emerging doctoral scholars in either the DBA or the PhD in management or the doctoral programs in health administration or others, is to think across boundaries. Don't think small. use systems thinking to kind of guide you to see what you're passionate about, how it connects to some of these things, and go into the literatures and find those. Because again, that's one of the beauties of our field, is management and leadership is integrating and broad. It doesn't have to be narrow. You can go into look at sociology. You can go into economic theory. You can go to other places to do really interesting and original things. And I think it's a curse in the sense that it doesn't provide you super direction, but it's a blessing that it keeps the door open, so that way, if you find something you're passionate about, you can build a study around it that will be very useful.
Absolutely. Absolutely.
Well, if there are no other questions, then Karlyn, I really appreciate you giving me the time to talk a little bit about this, and I'm looking forward to attending what sessions I can in the next couple of days, and wish everybody well. It's so exciting to know that we've got folks that are making maybe perhaps the first public presentations of their doctoral research, and that's always an exciting time, and I hope people have fun with it.
That's right. It's an exciting 2 days. So everybody be sure and sign up for as many sessions as you can. And good luck with all the presentations, and we'll be here supporting you. Thanks, everybody. Stay safe and be kind.
Take care, everyone.